Welcome to Emerging with Grace.
Waiting my life for the sunshine.
The show where transformation takes flight. I'm your host, Doc G, and together we're diving into the complex, mystic process of becoming. Life can feel like a chrysalis sometimes, right? You're stuck in the in-between. You're breaking down old patterns. You're shedding old skin. And you're waiting for the moment you can spread your wings. Here's the secret. The chrysalis isn't just about change. It's about grace. It's about finding beauty, joy, and strength. In each episode, we will chat with incredible women who've gone through their own chrysalis. These trailblazers have faced heartbreak, career pivots, self-doubt, or reinvention. And they've emerged stronger, wiser, and full of grace. You'll hear their raw stories, powerful lessons, and how they turned the in-between into a catalyst for prominence. Who is this show for? It's for you, the dreamer, the doer, the woman in the thick of transition, wondering how to navigate your own chrysalis. What will we talk about? Everything, from self-discovery and guidance to grief, loss, and the power of love. When will you get this? Every 2 weeks, we're here to inspire your mornings, boost your afternoons, and bring peace during late-night reflections. Why? Because no matter where you are on your journey, you deserve to know you're not alone and that grace is waiting for you on the other side. So get your tea or your coffee, your journal, your favorite cozy spot, and let's dive into stories of transformation, resilience, and the unrelenting power of grace. Let's spread those wings together, my friends. It's time to transform with Emerging with Grace. And now let's meet today's guest, who's ready to inspire you.
Waiting my life for the sunshine.
Hello there. Today we are talking about Needles of Wisdom with Dr. Micah Allen, and it's a journey into holistic healing. I am joined by the brilliant Dr. Micah Allen, a nationally recognized integrative health leader. She didn't choose a career in healing. She was called to it. Her journey led her to become a licensed naturopathic doctor in Washington State and an acupuncturist in Virginia. Dr. Allen is the owner of Essential Natural Health and has shared her expertise on CBS, ABC, and in countless media outlets. We were just talking about a couple of them. Twitter, Instagram, and TikTok, right?
Yes.
Okay, fantastic. And with she has a rare blend of wisdom, evidence-based care, and a holistic insight to empower clients in activating their lasting wellness journey. Her collaborative approach ensures that each person that she works with is uniquely addressed and helps them create long-lasting, meaningful improvements in their overall well-being. There we go. Today we're going to dive into acupuncture, how it works, what it treats, and why you might be missing it in your wellness journey. Our quote for today is, "True healing doesn't just treat symptoms. It brings a whole person back into balance." So, Dr. Micah Allen, talk to us about how you got started. What made you journey this way?
Absolutely. First off, I want to say I listened to your intro before hearing it today with introducing me, and it's just as equally as powerful as it was recorded. So thank you so much for the introduction.
Yes.
I would say that, like you said, medicine, at least acupuncture, definitely found me. So I was in medical school studying naturopathic medicine, and I was experiencing frozen shoulder syndrome. And I grew up in rural South Florida. And
Really?
yeah, so
Okay.
I mean, first off, naturopathic medicine isn't huge in rural South Florida.
I'm sure.
But
That's why I said really.
acupuncture, absolutely. I had not ventured into that at
Okay.
all. So some of my colleagues were like, you should go and check out the acupuncture school. We're a student, so you should get student discount. I was like, okay. I went in for a consult
For yourself.
for myself because I
Okay.
literally could not move my shoulder.
Okay.
It's like 16-hour days, in front of a computer, clinical rounds, didactic studying, and I think just the stress of it all was just overwhelming to the system.
I can see that.
So I went to acupuncture twice a week for about 6 weeks during the summer, and it completely resolved my symptoms.
Really?
Like gone, never to come back again. And so from that point, thankfully I was still in school.
Right.
I said, okay, well, I'm going to go up to the registrar's office and get myself signed up for acupuncture school. So I started it about 2 years into my naturopathic medicine degree. And so I was
Double.
able to do them concurrently.
Okay.
Yeah. So
That's
was
a lot
how
of work.
It absolutely is a lot of work. But I figured, while I'm
You
here.
were already doing 16-hour days.
I know.
Okay.
I know. While I'm here, I might as well get it done.
All done.
So I don't have to worry about having to come back. And yeah.
Okay.
There's definitely
Okay.
special people who decide to do what they consider a
So you
dual
were
track.
called to it
Absolutely.
because you can't do what you don't love.
And I absolutely love it.
Good.
Yeah.
Good.
Yeah.
So why Florida, Washington, Florida to Washington? Ooh, I love your nails. That's
Thank you.
Gorgeous. Florida to Washington, and then Washington to Virginia, or was there something in between?
No, it's pretty much it.
Okay, so
Yeah.
why the big jump to Washington?
Yeah. So in Washington State, the university I attended for naturopathic medical school is Bastyr University. And so they are recognized as one of the leading universities for natural medicine.
Oh, okay.
And so that's why I opted to take that long journey. I still remember my dad, myself, and my Jack Russell Terrier
Oh.
and my Honda Civic. We drove for,
I had a Honda
oh my
Accord.
gosh, 5 hours
Yes.
straight, 12-hour days
Ooh.
to get me to Seattle, Washington. But I went because of the rigorous studies and their relationships with the National Institutes of Health, with the University of Washington. So there was a lot of vigor as well as research base. So I wanted to go where I felt like the best was.
Okay.
Yeah.
So that was the elite.
Yeah. So it's considered one of the leading universities for natural medicine.
Okay.
Yeah.
So do you still utilize it?
Absolutely. Yeah.
In what way?
So for me, acupuncturists, we have a certain level of understanding and knowledge, right? So you still have your anatomy and physiology. The approach is the approach under the guise of Chinese medicine. Whereas naturopathic medicine is looking at the whole person, as does acupuncture. But with that, we're going to be looking into what's at the root of what's happening with you, and not from a Chinese medical perspective, but more of like, okay, do you have something functionally that's not operating well? So want to be sure, like when you come in, that you've had your annual exam. If you haven't, making sure that that's in place and that you have, a relationship with your primary care physician. So really looking at the whole person, making sure that preventative screenings have been done. Because really, when we look at health and as it stands currently, I think a lot of times we will see symptom management and not necessarily looking at, okay, why is this person presenting in the way that they are?
Now, see, that's what I was thinking. Because it seems to me that, and I don't want to take anybody's craft away from them, but it seems like the medical doctors look at symptom A leads to this. So do they have B, C, and D over here? which would give them a diagnosis of whatever.
Right.
And just in all fairness, I want to let them know, I actually saw Dr. Micah Allen at a health fair. Mm-hmm. I can't remember the name. I would love to give them their props. But I went to a health fair to support another person. And when I went, I decided it was a long walk from the garage, and I was kind of in pain. So I was like, oh, I'm just going to stay in this cool air for a little bit. And as I looked around the room, I said, oh, you guys have some really interesting people here. So my thought was, I'm just going to walk around, collect some business cards. And I stopped at her table, and I think you were on the way out, but Jade was there.
Yes. We had 2 events happening in one day.
Okay. So I talked to Jade, and she was like, yeah, Jade is very no-nonsense. So she was like, yeah, here's our information. You got to check us out. Mm-hmm. And I asked before you left if you'd be interested in a podcast. Mm-hmm. But I didn't jump into that right away. So my personal journey is I had been in an accident a couple years back, and my girlfriend had suggested acupuncture, and I was like, girl, no, I'm not getting stuck by needles. It's just not my thing. It's not what I want to do. But I also don't like taking medication. And the doctors had, I forget what the surgery is, where they burn your nerves. I can't think of what that is, but they said that if they burned my nerves, everything was going to be okay. I was going to walk better. I was going to be able to do things I didn't do in the last year and a half. And that happened, and I was worse. So I said, well, let me try this acupuncture thing and see what happens. I believe I was with you 2 or 3 months before I actually started weaning myself off the medicine. Mm-hmm. And now I'm completely off medication. So normally when you go to the doctor, they say, what's your pain level on a scale of 1 to 10? And I would go to the doctor and be like, 7. You know, it's 7. Like, I wake up in 7. I try not to go to bed at 10, but most of the day is 7. Mm. And after seeing you, I want to say maybe twice, I was down to 5. And then I was down to 3. Mm. And now when I go in and she asks me, what's your pain level? I say, I'm just stiff. You know, I wake up stiff, and I work through it during the day. I'm able to do my water aerobics. I'm able to get back into life. Mm-hmm. I still haven't walked the dogs yet, but I'm getting there. Yeah. I'm getting there. So I wholeheartedly believe in what you're talking about. Mm-hmm. Like, I am amazed because they predicted 10, 20 years down the line. I've seen people who continue to get those surgeries, and they're just like bent over, and they can't stand up straight, and they're always in pain. And I'm like, I don't want to get this surgery every 6 months, every year. So what can I do? Right. And I called Jade, and Jade said, okay, this is what we can offer you. Yeah. And then I came in to see you. It has been a life-altering event for me. And I absolutely cannot say enough about acupuncture at this point. Yeah. So if you can explain it just a little bit, because I know it's not just pain that you work with. Right. So what is it that you suggest somebody would come to you for?
Yeah, that's a really great question. And I think because Chinese medicine is a system of medicine within itself, right? Mm-hmm. And so when we think about, our conventional system here in the U.S., it literally can be applied to any presentation, everything. Right? Okay. And so the same is true for Chinese medicine, except obviously if you have broken a leg or if you're in acute myocardial infarction, which is a heart attack. Right. All of those things you need to report to the ER for, right?
Not you. So right. I'll be there in a couple of weeks. Absolutely. I think I'm having a heart attack. Okay.
Absolutely. But anything, I'll just run through today what we saw. So We have clients who are currently undergoing chemotherapy, who are coming for support for nausea or fatigue. We have clients that we see who are working with for fertility support. So some who are going through IVF or IUI or trying to naturally conceive. We have thinking about one of my teens who has vascular migraines. She's had pretty persistent migraines that have not responded to any medications.
Oh, wow.
And so we really focus on the folks that we end up getting are the complex, most of the time chronic cases that have not been able to get relief or support from anyone else. So most of the folks who show up is kind of like we're their last ditch effort, and I like to say we're your last effort, but we're the
you were the best for me. It
we
wasn't
end
last
up-
ditch,
Yeah,
but
yeah, we end up being a really great option
Right.
after it's all said and done. And I do still want to, validate my conventional medical providers as well, because I like to tell folks it's a team effort, right? So when it comes to those preventative screens, if I see someone who has, obvious signs that they need to see a provider, so things that are red flags or alert me that they need to be investigated further, I'm going to refer those folks out to partners that I've developed partnerships with in the community.
Okay.
And really, when we think about providers as a whole, it's about what you have in your toolbox, right? My toolbox just so happens to be very expansive and focusing on root cause and preventative medicine. So,
okay.
yeah.
Okay. Now, I invited her to a meeting with some other colleagues, and we got there, and this lady said, well, do you know how to do, what was it?
It was the SAT treatment, which is the Solomon auricular acupuncture treatment.
And I'm just sitting here with my mouth hanging open because she was like, yes, I could do that. And the lady's like, oh my gosh, I couldn't find anybody to do this. So what exactly is that for?
Yeah, so the SAT treatment is specific for allergies. It's a very specific protocol that's taught and trained by Dr. Solomon out of Rockville, Maryland. But most of the clients that we see for SAT treatment are folks who are experiencing symptoms of alpha-gal syndrome. And alpha-gal syndrome.
I was going to say, look, that's beyond my pay grades.
Well, it's beginning to pick up a lot more steam. Folks are starting to realize that they might, or it might be something that they're experiencing,
Okay.
but it's contracted by being bitten by a tick, a Lone Star tick most of the time. And what develops is an allergy to red meat.
Really?
So the consumption of any sort of beef or any hoofed animal, the person will experience digestive presentations.
Okay.
They might become anaphylactic. Some folks are sensitive to fumes because gelatin is a part of that whole process. Medications can sometimes make people sick or uncomfortable just because they are unaware that they might have alpha-gal syndrome. So the SAT treatment is pretty spectacular because...
Oh, she was so excited.
Oh, yeah. We don't, never purport a cure.
Right.
But what it does is it puts the body into a remission to where cross-contamination, so say, for instance, if someone were to go out to a restaurant and have a meal and their meal was cooked in the same, pot or in the same dish as a piece of beef, the response to that is going to be dramatically reduced, or even in some people, not at all. So that's
So what can you do about gluten intolerance? Because
they're very interestingly
that.
enough, there are thousands of digitally enhanced samples
Really?
that we use in order to detect a specific point for each allergen, and then that point is placed in the right ear, and it's either in place for 3 or 4 weeks. So it's a temporary needle, very small. Might I add, I have to use a tweezer to place it.
Oh, really?
Very, very small. And so typically clients will, like I said, have that treatment in place for about 3 to 4 weeks, and then they return, have that needle removed.
So the needles, it's not like
It's not like your typical
Okay.
acupuncture treatment. No.
Wow, really?
Yep. And it's very, very minimally like uncomfortable or discomfort. And the whole, guys, is just making sure that the ear remains dry. So we give you these cute little shower caps for your ears. But yeah, it's a pretty phenomenal treatment. We have some information on our website about it. It's definitely
Dr. Micah Allen.
drmicaallen.com.
.com.
Mm-hmm.
Okay. So, okay. Everything you mentioned is stress related.
Can be.
If you have cancer and you're getting chemo, that's really stress related.
Yeah.
If you there were a couple other things. I'm sure if you didn't know you were allergic to beef and you've been eating it your whole life, that has to be shock,
Right.
along with an adjustment. The poor teenager that you mentioned, we don't think of teenagers as having something that they can't fix.
Right.
Although, we know of cases, that's not what we normally lean towards.
Right.
So I know that with all of this being stressful, does acupuncture sometimes just help with the relief of stress?
Absolutely. So I like to explain it as what we're doing with the acupuncture each time that you come in is we're literally retraining your nervous system, right? And so really just existing and living is a stressful experience, no matter how
It is.
no matter how blissful your life is. There's no way as humans that we can escape stress. So for me, it really is about retraining your nervous system so that it's not hyper responsive, right? So we're not in that sympathetic response consistently, which is, again, if we're just experiencing life for the most part, and especially if we have additional external stressors, we're going to literally feel like we are attempting to, not be in imminent danger. So your body is going to upregulate what we call that fight or flight response in order to keep us safe, right?
Okay.
And with that, we have increased amount of cortisol production
I
from
was
the
just
adrenal
about
glands.
to ask about cortisol. Go ahead.
Yep. So that's going to be elevated, and that has an effect systemically. So that can impact your blood sugar, elevating it, right? So we know as a society, at least in the U.S., there is an epidemic of metabolic syndrome, which is glucose or elevated blood sugar. That in turn can cause impacts on the cardiovascular system. And so we know that heart disease is the number one killer of both, men and women when we really stare it down in the
So
face.
we're looking at diabetes, high blood pressure,
Yes.
and cholesterol.
Yes.
Okay.
Yep. So all of those things can be negatively impacted by that cortisol being increased or the adrenal glands overworking themselves. So with acupuncture, we literally are telling the body each time that we initiate a treatment, it's okay. You're not in imminent danger.
You're good.
You're good, right?
Okay.
And each time that you come in, your body starts to learn and say, I am okay. I'm good. Over time, the frequency of acupuncture decreases, but your body has learned, right? There's a new operating system. We're okay, right? But if something does come up, then your body is able to move from that new baseline that you have to get you through that moment. But then it's better apt to bring you back to that baseline. It's not just going to hang out there and be hyperstimulated.
Okay.
Yeah.
So you mentioned a couple of things I want to go back to. One of them was your frozen shoulder.
Yep.
Does that come back every now and then? Do you have to go back and get no?
Not really.
You have that look like, no.
And I think now, like I said, my nervous system was retrained. And then there's also stuff, this is where naturopathic medicine comes in, that you do to help prevent, right?
Okay.
And so stretching. You talked about with your stiffness, you work through stretching in the morning so that way you can get through the day.
Right.
Making sure, that I'm having my annual exams. I don't have any deficiencies, so magnesium and vitamin D, making sure my hormones are regulated, doing my best to eat as well as possible, right?
So, okay, that's a whole lot of questions. Yeah. So you're saying, taking supplements and making sure you're on top of different things that are going on with your body. But you have like a natural store.
Yes.
Talk to me about that.
Yeah. Well, because I have been in this wellness industry now for more than a decade, I've had the opportunity to see, hundreds of thousands of people at this point. And so you start to see rhythms, right? And obviously every person is different. But with those rhythms, you start to say, oh, okay, I noticed that this tends to work really well for this subset of presenting patients or clients.
Right.
And so we have different formulations for stress relief. We have allergy support. There's also magnesium. So magnesium glycinate is now,
It's popular.
it's
yes.
very popular. But, we've been using it in natural medicine now, or naturopathic medicine, for probably the last 10 years. And so things that we've seen over time that have been helpful, consistency, and that have research-backed, clinically effective formulas we have available either on-site at the clinic, and we also have them virtually by way of the website.
Okay.
Yeah.
You mentioned hormones.
Yes.
So you already spoke about IVF and people going through infertility and, that stress.
Right.
Women go through a whole lot more from the beginning of puberty
Yes.
to the end of puberty. So the big M, the
Yes.
menopause. I know that when I first started, I had, by way of my diet and what I ate and what I didn't eat, controlled my hot flashes. But when I first started, they came up. And you
Right.
said, oh, okay, well, do X, Y, Z, and you stuck me in different places.
Very, very specific, different places.
Right. I don't pretend to know. So I'm not that kind of doctor. So talk to me about, like, if something else comes up,
Yeah.
like it did with me,
Right.
how you just know where to, well, of course, I'm sure they teach you where to stick. But
Yeah. Yeah. Oh, my goodness. I think that was, aside from learning medical Chinese, because I'm also a Chinese herbalist as well, learning the 400 plus acupuncture points, where they're located, what they're indicated for, how deep I should be placing points, right? Oh, my gosh. I was like, I'm so ready for this point location class to be over. But when things come up, right? Now I'm so happy that I got through that.
Right.
Because, if a hot flash comes up, okay, then the diagnosis of kidney yin deficiency comes up. I know what points are going to be great for helping to support kidney yin and clearing heat that's rising, right?
Okay.
So all of that is just a part of the training. And so when it comes up, I know
When
exactly
you've been in
how
it
to,
for a decade,
Yeah.
you understand that
right,
some things may go to the left,
right,
but you know what to, okay.
how to pivot.
Oh, yeah, you pivot well because I'll come in with something different all the time. Yeah, that, but can you get this over here? So, yeah.
And really, at the end of the day, it is all like a picture, right, that we're looking at. And say, for instance, if you're doing a color by number and you mistakenly, use a different color for a number that you shouldn't have used, it's almost kind of like right away that something's out of place. Oh, I shouldn't have used that. I can go back and do this instead. Now the picture looks as
Semi-normal?
yeah.
Semi-normal?
Yeah.
Okay. So, now, I do realize with some like massage, you should only do it for a certain amount of time
Right,
because after a while it starts to wear and tear on you.
right.
Does that have the same effect in acupuncture, or is it just something if you want to, you could do it 92 and still be okay?
We do have some centurions in our clinic. So I have seen patients as young as 6 months.
Okay.
And we have some
Now, how do you know
100-year-olds.
if a baby needs to get acupuncture?
I know. So think about this. We had a 6-month-old during our time in clinic in Seattle. The baby was severely asthmatic, had been through the ringer as far as medications, observations, MRI, CT, chest x-rays, everything unremarkable. Literally was in the emergency room 4 days out of the week, right? Parents are just over it. I'm done. We're going to try something different. And babies are really fascinating because as adults, we have, if you think about it like an onion, we have all these layers. But babies, they're brand new, they're fresh. There's not much between them and feeling great, right? So it was maybe like 2 days, and the baby, had not been to the ER. And then after a week, it went from maybe 2 days at the ER during that week. And then after about 3 weeks, no ER visits for the baby. And we were doing a combination of acupuncture. And with babies, it's not like what is done in adults. So you literally are placing the needle and you're removing it. So you're activating them just by way of the quick puncture and releasing. Again, because they don't have all that restriction in place. So yeah, that was a 6-month-old. Chinese herbs and acupuncture, asthma, out of the ER 4 days a week.
Fascinating.
I agree.
I don't know. The baby has colic. Can the acupuncturist can you get that? So
Yeah, and we don't see a ton of that young of an age clients at my office in Midlothian, but it's definitely possible. I have colleagues who are, specialize in pediatric acupuncture. So yeah,
I would have never guessed.
yeah,
Now, as you age, I can see that.
right,
Bones get brittle and
Right.
different things. People fall, or you have the risk of them falling.
right.
But babies, that's impressive.
Yeah,
I don't know, as a parent, I would have I didn't think of it as for myself.
Right.
So I had to be pushed that way. So, so it sounds like just about anything.
yeah. Like I said, as far as it's not anything acute, nothing you need to be in the ER for, broken bones, like actively broken. Now, do
Right.
we help people recover from broken or fractured bones to help increase healing? Absolutely. But if you're out there and you sustain an injury, we absolutely want you to report to the ER before you see us.
I love that.
Yeah.
I love that. So, do people stay with their practitioner while they work with you?
Yeah, and in the state of Virginia, it's actually a requirement for acupuncturists
Okay.
for you to have a primary care physician. And for the reason being, and I completely agree with it, to make sure that you're getting, complete total care as far as those preventative screenings. And it really comes down to cancer treatment as well, to be sure that folks are being monitored and,
Right.
and treated appropriately.
So, if somebody is in a cancer state,
Yeah.
you collaborate with their doctor, or do they just see their doctor once a month? How does that work?
Yeah, we don't necessarily dictate any sort of treatment that their oncologist might be providing them. We just have to ensure that they have established care with an oncologist. And now the clients that we see for cancer treatment, they can range from folks who have, terminal cancer, who have decided not to do any treatment at all. They just want palliative care. So for me, it's always really important to be able to meet whatever patient or client where they are. And if I can be of assistance or service, even if that means palliative care, then we'll do that. Now, that's been a little bit more difficult for me as
I'm
a
sure.
provider the last few years, just because we've seen such, I would say, an uptick in not just terminal cancers and folks that you would think they would occur in, but in working class and folks who are similar age or who have kids. So that's been difficult, but yeah, we still provide space and make sure that that person is getting the support they need.
Okay. Now, you also have a massage therapist within your services. How does the two work together?
Oh, so well. So Kathy is our massage therapist. Oh my goodness, she is phenomenal. So she does medical massage, but she also incorporates acupressure, lymphatic drainage. So she really is doing kind of the same thing that I am, being very intuitive around what the person needs as far as body work is concerned. And really just, oh my God. Yeah, if you guys check out our reviews, you'll see a couple on there for Kathy, but she's phenomenal.
That lymphatic drainage is wonderful for those allergies.
Yes.
I absolutely love it.
Yes.
But so, okay, I don't want to keep you all day. I know you're busy, but
Yeah, this is great.
my thoughts on this is, I know Oprah talked about it for menopause. Now what we're seeing is an uptick in autism for children, and we're seeing an uptick in girls who are accelerating with their hormones quicker than they used to.
Right.
Is there something that a parent would want to work with you with on these things?
Yeah, we have, like I said, a pretty wide variety of clients as far as age and presentation. And the two that you just described are most certainly clients that we help support. I would say with autism, really looking into environmental triggers, right? Whether it be home or school, and also obviously diet, nutritional deficiencies. So looking at, micronutrients. And so that is a separate part of my business, which is the naturopathic medicine consultation, which is a little bit different from acupuncture, but it's a deep dive into just all facets of the person.
Everybody's individualized.
Right. Yeah.
So, okay.
Yeah. So
what's a deep dive look like?
Yeah. So that looks like looking at, like I said, that environmental approach. So any labs or any imaging, anything at all that the person has had, bringing all that information in, and I basically scour through it, right? Looking for anything that I think might be missing that they should investigate more. And then making recommendations based off of not just our interview, but the data and the information that I have, and creating a really personalized treatment plan for that person.
Okay. Okay, so I'm going to be honest.
Yeah.
I told my doctor, I said, well, I'm starting to end my services, so let's just see how that works as I go from here.
Yeah.
But with you saying that your frozen shoulder hasn't come back, or you don't have to worry about, of course, I'm still not lifting.
Right.
You keep telling me, don't get too happy. So,
you can get a little bit happier. It's my people who are 2 treatments in, and they're like, oh my gosh, I feel so great.
Yeah.
I talked to somebody today. He's like,
I'm gardening again. So
gardening. This guy's 2 treatments in. Oh, I helped my brother-in-law replace the fence this weekend. I'm like, oh my God, just take it easy. I know you feel great. It's been a while, but you got a little room. You can do some things now.
Yeah, I'm gardening. Yeah, I mean, I take my little seed out there and do it, but everybody's talking about, oh, your yard is looking better again, because I had neglected it for 2 years. So I'm loving life right now.
Good.
I'm just nervous.
Yeah.
I don't want to let you go. It would be just oh, no, I got to go back. Because that's what we're trained in with our regular Western medicine
Right.
is you got to go back and get that monthly
Right.
or that semi-annual. Because right now I see my doctor for my back every 6 months.
Right.
So we're trained like, no, it never ends.
Right. Right.
So you don't.
That's, I mean, and I know it's really rare to hear somebody say this, but my job is to make sure that you
I don't see
need
you ever
me.
again. Huh?
Not ever again. And also knowing, too, that we are here, right? And so, again, another example from today, a client that we hadn't seen in probably 2 or 3 months called yesterday. And she was like, yeah, I need to get back in. And I saw her today, and it was something a little bit different that she wanted to work on, and we worked on it. So that's the good news. I mean, I don't plan on
Not
going
the old
anywhere.
plans.
Yeah.
But yeah, just in case something else pops up.
Right.
Oh, that's fantastic.
Yeah.
That's fantastic. I'm trying to get my mother to come visit and say, we're just going to take you over here. Now, she's not afraid of needles, but what do you do for people who are?
Yeah, we do have other modalities that we incorporate. So one is a low-level current, which is using a microcurrent. And so the client literally feels nothing most of the time, unless they have not had proper hydration, then they may feel a little tingly. But aside from that, we can use that as an option. And then our needles are already very thin, about the size of one strand of your hair. But we have even thinner needles that we can use as well. So probably bring the needle count down. So that means I have to get a lot more specific with my treatment plan. So instead of using maybe under 20 points, I can whittle it down to just 5.
Wow.
So, yeah, I can get creative.
Okay. And one of the other things I remember is cupping. What is that?
Cupping is a wonderful technique. It helps especially with muscle tension or if there's pain and discomfort. But it basically is bringing blood flow up to the surface, right? So it helps with removing any sort of what we call stagnation or blockages and allowing just really free flow and bringing very oxygenated and fresh blood to the area.
Okay.
Yeah.
And do you work with people who have addictions?
Yes.
Talk to me about that.
Yes. Oh my goodness. So many. I'm thinking about my own toolbox. Oh my gosh. So the addiction treatment it's called the 5-needle protocol. It's actually used a lot in addiction centers or addiction treatment centers. But it's a treatment that's specific to just points in the ear, and they're very specific. So that is an option as well for addiction. And we do see a lot of veterans as well. So that same treatment can be used for PTSD.
I was just about to ask. Okay.
Yeah.
Okay. When you say the ears, is it that little tiny needle, or are we talking like, is it beads? Not beads.
It can be beads.
Okay.
It won't be the same needles that we use for SAT.
Okay.
So it's going to be your traditional acupuncture needles
Okay.
because they won't be retained. So it would just be during a treatment that you have those in.
And then they go home.
Yeah. And then they come back. Well, with addiction, you have to come pretty consistently because we got to break, again, that operating
Mental.
system that's been in
Okay.
place. So that treatment
Because your
frequency.
body's addicted as well
Right.
as your mind.
Yep.
So,
Yep.
okay. And there's an emotional attachment as well. So.
Absolutely.
Okay. Well, I am just really thrilled that you could stop by and
Yes.
talk to us about all this. Who, if you had to, like, take our population from 6 months to 95, who would you suggest would be your perfect client?
Oh, my goodness. So I'm going to take, is it okay if I take age out of it?
Yep, this
Okay.
is your client. Like,
So my ideal client is a client who has not been able to sort through or find answers to something that's preventing them from having the quality of life that they have set out for themselves. So if that's the boomer who just retired, who's looking forward to vacationing and exploring the world with their partner, but low back pain is not allowing them to do that. That's our ideal client. If it's a 33-year-old woman who's been actively trying to get pregnant for the last 5 years without success and haven't been able to, figure out how to do so, even with the help of reproductive endocrinology. I would just say anybody who's looking to enhance their quality of life and have just had a really hard go at doing so, we're the place to be.
That's fantastic. Quality of life. That's what everybody wants.
Absolutely. And everybody deserves that.
Exactly.
Yep.
Exactly. Well, thank you so much for coming.
Yes.
Maybe we'll have you back to talk about your shop next time
Yeah.
a little bit more.
Yeah,
So
absolutely.
because you have several different things that you do with your shop. You have like not overeating, but I know that's an addiction, but weight loss as well.
Yeah.
Okay.
And we didn't talk about the Chinese herbal component at all, but that's like, you have the supplements that are available on site that are bottled and can be shipped out. But for our clients who are in-house, we also do customized Chinese herbal formulas, and those are just made,
Based on what?
based off of the person.
Wow.
Yeah.
Okay. Well, you got a whole lot. That's a big market. So if somebody wanted to make an appointment with you,
Yeah.
how would they reach you? I very seldom recommend products unless I like them, I use them, and I agree with them. So when I tell you that this lint-free, no tree, 100% bamboo, biodegradable tissue is strong, 3-ply, and beautiful, I'm trying to tell you, Leafy is it. I will leave my coupon code in the bottom of the description. It's DocG25.
Yeah. So I have wonderful staff that I'm elated to be able to support me. But you can give our office a call at 804-464-3315.
Okay.
Or you can check out our website, drmicahAllen.com, and that's just drmicahAllen.com.
Okay.
And then
Micah is spelled
Micah. Yep. Just like in the Bible.
I was thinking that.
Yeah.
But okay.
Yes.
And you were going to say one more thing?
Oh, I was just going to say, I'm thinking your notes, right? Mm-hmm. There should be tags for Instagram.
Oh, yeah. It'll be.
Yeah.
For the YouTube, it'll be under for Instagram, and I forget what sites I'm on now, but it's always underneath.
Yes,
so that
in the show notes, right?
In the show notes. That's what they call them.
Yeah.
Yes.
Yeah.
They're always there.
Yes.
But for those in Richmond, those who want to buy medicine outside of Richmond area or outside the Virginia area, they can go to your website.
Yep. So on the website, drmicahAllen.com, there will be a specific page that has shop. And if you click on shop, you should be able to navigate that. And we have options for, I think there are options for pay later. And so you can do that. You can use your debit or credit card.
Okay.
So, yeah, it's pretty easy to navigate.
You got it all right now.
Well, trying, right? We're always trying to make sure, like I said, that we can be a service.
And you could get that quality of life.
Yes. And knowing
That's what I think everybody needs.
Yeah. And having that knowledge is kind of it's not difficult, but for me it's difficult not to share or want to make sure that folks have access to that. So
that's a compassion
Yeah.
that you add to it.
Not
everybody has that.
Yeah.
So thank you so much for joining us.
Thank
and
you.
Hopefully maybe you could come back again sometime
Yes.
and talk to everybody about how 6 months old and centric people
Yeah.
can be happier with this. So
Yes, ma'am.
thank you.
Yes, it's an honor. Thank you for having me.
And that's a wrap for today's episode of Emerging with Grace. Ladies, remember, every challenge is part of your transformation. Just like the butterfly, you're meant to emerge from the chrysalis, stronger, braver, and ready to soar. Until next time, keep living your life in the sunshine and never stop flying higher. Share this journey with a friend who needs to glow and encouragement. Invite them to join our growing community of women who are rewriting their stories gracefully. I'll see you back here in 2 weeks for more inspiration, powerful narratives, and tools to help you shine brighter than ever before. This is Doc G, reminding you it's always your time to transform. Let's rise together, one flight at a time.
I don't reject myself, I reflect myself. I'm embracing every moment, won't neglect myself.